Hi, I'm Indi and I'm 23 years old. I decided to get breast augmentation just to help with the symmetry of my breasts. Also, I wouldn't mind them looking a little bit more fuller. So yeah, mostly for symmetry though. I chose Mentor implants. That was the suggestion from Dr. Vessels, who I trust very much. So he said to go ahead with that, so off I went with them. In my initial consultation with Dr. Vessels, we discussed a little bit about sizing. So we looked at some 3D images of my breasts and got to kind of see what they'll look like. After my initial consultation, I was very hell-bent on going straight ahead, so I booked in and yeah, that was the end of it.
Okay, Indi, so what we're going to do today before you see Dr. Vessels for your prep appointment, I'm going to run you through a few things for your upcoming procedure and you'll be good to go. Alright, Indi, I'm just going to run you through everything that's included that will come in really handy for your recovery. Here we have your compression bra and you have your cooling packs, your Stratoderm. So this is your scar treatment gel. You use this on the incisions at 6 weeks. So your implants, they do come with lifetime warranty, and there is a little QR codes that you can scan and then just bring up a bit more further information about your implants.
Indi, I will run you down through the breast augmentation, how we're going to do it. So we're going to use teardrop implants, we're going to use textured implants in that. You wanted a more natural shape, also have a little bit of asymmetry in your breast, so we want to reshape your breast. I'm going to make a small incision in your breast fold. We're going to go underneath the muscle. We're going to put the implants in and we're going to use a dual plane pocket, so meaning about 70 or 80% of the implants covered by the muscle. The rest of the implant sticks out. The first 3 days you'll feel uncomfortable. At about day 7 to 10 you'll start feeling like a human being again. At about day 10 to 14 most people stop taking their medication, their pain medication. At 3 months you can do any exercise, running, contact sports, everything you do. When we put an implant in, there's some risk factors. There's always a risk factor for infection, bleeding. Risk factor, your nipple sensation can change. We're going to use a teardrop implant. They can rotate. Chance of that happening is quite slim. Like we recommended before, you need to go for a yearly breast implant check. Operation is going to take us about an hour and a half. We're going to sit you up during the operation to make sure we're happy with the size. We then wake you up and you go to the recovery process.
After you get them in, how long do you stay at the hospital for before you can go?
About 4 to 5 hours. So you need someone to come and pick you up and then look after you. Yeah. We're looking forward to operating you and hopefully you get the result we wanted.
How are you feeling about your surgery?
I feel very excited.
The experience, what you imagine it to be so far?
100%, super easy, everything's explained really well, and I'm super excited and happy with everything, so I can't wait now.
Have you learned anything new today that you weren't expecting or had any of your concerns alleviated?
I think just general jitters, I guess pre-surgery jitters have been smoothed over. I know I have a lot of people looking out for me and I'm in safe hands, so other than that I'm really ready to go.
So, like I said, a little bit of asymmetrical implant. Your breast is going to be a little bit tighter on the right, the left is going to be a little bit softer in that. We're also going to take a little bit of fat graft here to give you a little bit of tighter cleavage, because we use a smaller implant in. Initially going to be very tight, the implant's going to sit very high, and then the teardrop implant's going to shape your breast. It's normal to be a little bit nervous. Any questions you have?
No, I'm pretty ready to go. Thank you.
Ready to go in? How was getting marked up?
Yeah, it was good, it was exciting. It's just good to know what he's going to do and yeah, I can't wait. So it's day 1 post-surgery. I'm feeling pretty good. I'm a little bit sore, but nothing too crazy. I've been able to walk around. Good advice to feel better. The ice packs are really working but I've got this awesome pillow that just helps me sit up, so it's a bit easier. But other than that, I feel pretty good. Some advice the surgeon gave me was just obviously to take it easy, but to make sure you're being a little bit mobile as well. And I've just been doing all that and eating and drinking lots of water, which helps. So yeah, I'm feeling pretty good. It's been a week since my op, so my recovery's been pretty good. Getting up out of bed was a little bit tricky the first few days, but the medication helped. It was a little bit of a blur. Showering was interesting. It feels a bit funny. It's quite heavy, so I would just feel like hunching over, kind of holding them, but it wasn't too bad. I got my mum to help me on the second day after I had them. Any advice? I would say just to keep using your ice packs and have a good pillow that you can push up off. That helped me heaps, especially in the middle of the night when I need to get my medication again, rather than having to like call my mum all the time.
Hey Indy, we're just going to change your dressings now. You're at 3 weeks post-surgery, so we'll change these ones today. You'll keep these dressings on for 5 to 7 days, and then you'll remove them yourself, okay?
Perfect.
And you've been quite mobile and things like that?
Yeah. I know when I had the fat grafting, I'm still a little bit bloated and sore and swollen, I guess.
Yeah.
What can I do to help with that?
That's completely normal. We do recommend you to wear compression tights for the next 6 weeks after, just so it helps with the blood circulation and the excess fluid sitting in the area, so that's probably why you're feeling so bloated as well. But that will subside in a couple of weeks.
Perfect.
Okay, so just keep moving around and being mobile, and that will flush out.
Yeah, awesome. When can I start sleeping on my side?
Okay, so you're now at 3 weeks, so you can definitely start sleeping on your side now, as long as it's comfortable for you, not waking up in any sort of pain or discomfort. You don't have to sleep elevated anymore. You can definitely just lie straight onto your side.
Okay, good.
One other thing we like to tell our patients is that you need to start massaging the scars.
And when do I start putting the cream on the scars?
When you're about 6 weeks post, start massaging them, pressing the scar cream into the incisions as well. It's going to help break down that scar tissue for you as well.
Perfect.
Use it once a day. Just use it until the tube's completely gone.
Perfect.
Do you have any questions about the dressings?
So just when I take it off, when 5 to 7 days after I get home, will the stitches still be there, or what do I have to do in taking it
So
off?
the stitches are dissolvable, so there's no need to do anything with them. Sometimes there are sutures sitting on top of the skin. Come back in and we can trim them close to the edge.
Perfect.
So your next appointment will be at 12 weeks with Dr. Vessels, and that's when you'll go over a few things with him as well. We also recommend you to book in your 12-month review.
Perfect. And that's every 12 months?
Every 12 months, yes. Perfect.
I feel really good about it. It's been a very positive experience for me. It wasn't as painful as such. It was overall a very positive experience. At the start, they were super tight, like ridiculously tight. Like I could say if someone chest bumped me, they could rebound off me. Like they're starting to definitely feel a bit more like me now, which is good. I kind of was thinking, oh gosh, will they always feel foreign? But they're definitely feeling more like me kind of in week 3 now, so they feel good. I'm super happy with them at the moment. I know one of them probably has to drop a little bit more just because of how uneven they were, but yeah, I'm super happy with how they're looking. Yes, they are, honestly. I think they look better than what I was expecting, and I'm surprised with how much they suit my body. They've exceeded my expectations. Looking back on that now, everything that he said makes a lot of sense for my body type. You have to think about your height and your shoulders and the look that you're trying to go for. I'm glad that I just listened to what he said, because now I'm like, oh my gosh, they're the perfect size, and I was slightly worried they might have been too big, but yeah, I'm super happy with them, and I actually couldn't imagine them being any smaller, so I'm glad I just listened. I wouldn't do anything differently as of yet anyway. I know I'm pretty new, so I mean, I think from what I've heard, you probably don't really get a good indication of what they're going to look like until about 2 months. That's what Dr. Vessels told me. But so far, so good. I wouldn't change anything. I'm super happy with the implants, but I can't wait to wear dresses and things without bras. That's like what I'm most excited for. I wish I actually did it sooner, to be honest. It's not as scary as what I guess people may think. For me, the whole process was super smooth. Even the hospital day was so easy, like everyone just looks after you. It was an awesome experience for me.